All right, so I talk about this a lot. One of my big soapboxes is concussions and the way that people are being treated or the lack of treatment thereof. I want to kind of put everything into a really small box and kind of a nutshell thing. I do a lot more than this at the office, but I want to make sure that people are at least seeing the things that they need to get done from a, minimum checkbox type of thing. So the first thing I want everybody to recognize is that just because you don't hit the head on anything doesn't mean that you don't have a concussion. What a concussion actually is the brain making contact with the skull in some form. Skull hitting brain, brain hitting skull, those two collide. That's basically it. And you don't have to hit the head for that to happen. If the head whips back and forth real fast, but it doesn't make any contact with anything, the change in direction can still affect that the skull and the brain collide and give us a concussion. This is where a lot of people fall down, end up with concussions, that type of thing. Now, a lot of times we have other issues. A ball, someone hits a soccer ball with their head, basketball hits them in the head, something like that, and even a football hit, and they end up with concussions, and those are a little bit easier to understand. But just remember that the big issue is that the skull and the brain make contact. So when we think that we have a concussion, the best thing that we do is a standardized concussion assessment test. It's a SCAT test. You can look it up on your cell phone, have it. Pretty much anybody can give this as long as they've kind of run through it once or twice. Once you think that you've got it, getting them somewhere where people can actually treat from that point on is the most important part. I would highly recommend that you find that person or that group ahead of time, because you don't want to be, having an issue, especially like during a football game or something like that. Friday, Saturday, somewhere in there, you have your concussion. Now you're thinking, oh my gosh, who do we go see? How do I find out? You want to have the person ahead of time. So find your person ahead of time. But the basic things are, so from the incident, from the hit or from the concussion, you want somebody to do this SCAT test, and then you figure out what their score is. And then about 15-20 minutes later, you kind of watch them, you have them sit down, kind of watch them. 15-20 minutes later, you do the test again. And you want them to score as well or better than they did the first time. And the reason for this is that we're trying to see if they start losing ground, if they start degrading. If they do, you have to immediately get them out to imaging, because we're looking for brain bleeds, because the brain is bleeding, putting more pressure on the brain. This goes from really bad to life-threatening pretty quick. So you got to make sure that you check that out. And I recommend that you do this every 20-30 minutes for 2 hours, hour, 2 hours, something like that. Once they've gotten past that point and you don't think that we have any further degradation or any brain bleeding or anything like that, we got to get into a dark room. The old 1980s, oh, they have a concussion, don't let them go to sleep or they're going to slip into a coma and oh, it's going to be terrible. That's 180 degrees from where you need to go. The only time that the body and the brain really gets a chance to heal is when it's asleep. So you've got to get that person to sleep as soon as we can. So after that 2-3 hours, make sure that it's not degrading, then we can get them to sleep. Get them to sleep. I also like to make sure that the body has all of the needed chemicals to repair the brain. So large doses of EPA, DHA, EFA, CoQ10, methylated B vitamins, the full spectrum, specifically L-methyl tetrahydrofolate. It's the fully methylated form of folic acid. So those are kind of a must for all of our patients. And then obviously lots of water, but I also like to give the patients coconut oil. And the reason I like to give them coconut oil is it's a very good fat, very good energy source for the body to kind of fuel off of as they're repairing, as they're sleeping. So let's say a patient gets into this dark room, so they don't have any input into their eyes, they don't have any sounds, there's no input into their ears, so their brain has nothing to do but heal. They don't have to process anything. So let's say we go through that for a day, 2 days, whatever it is, the patient finally comes out and they start to feel a little bit better. This initial point is when getting chiropractically adjusted is very important, but make sure you go somewhere where people know how to treat concussions. It's a little bit different than average adjusting. The reason for the adjustments is so that we make sure that the musculature in the neck doesn't bind up, doesn't go into spasm. If it does, it can make pressure in the head increase. And the reason it does that is because it doesn't allow for for the lymphatics to drain properly. And so we end up with sinus tension problems on top of concussionary issues, which compound the issue, make the pain much worse, and you don't really want that. So getting them adjusted is critical at this point. As they come out of the dark room and they start feeling totally fine in dark room, then we get them out into the light. If they have any hangover or concussion related migraine type symptoms of sensitivity to light, sensitivity to sound, sensitivity to smells, weird emotional stuff, we have to understand that they still have big issues to run with. And getting them out of stimulus and into the dark room is still kind of on our playbook. Once they don't have any of those symptoms coming out, we can send them back to school, we can send them back to work, whatever. And I always recommend that the first day you go back, you only do a half day, regardless. Come home, get some sleep. Lots of times I've talked to patients afterwards and they say, I thought I was totally fine, came home, went to sleep while I was supposed to, slept for 4.5 hours. Woke up, ate, went back to bed. So we see that the brain's not really done healing yet. You do that half day until you feel 100% at the end of that half day, like nothing's different. Then you go to your whole day. Once you feel 100% after a whole day, then these athletes can start going back and doing 20-30% of normal. Riding a bike, walking on the treadmill, light stuff. As soon as that doesn't cause any issues, then we can start ramping that up and all the way back to full back into the game. I like to ramp up 30% per day. So if the first section is 30% of the work. Once they clear that and everything's great, we go to about 60%. Once that's great, we go to 90%. Once we're there and that's great, then we can go back to game. That's the return to play protocol in a very small nutshell. It's very important that you get to somebody who knows how to treat this, because not only treat but diagnose it, because there's a lot of examinations of the eyes that you have to do, because the eyes are actually brain tissue, and that's why it's so important that we limit the input into them. No cell phones, no video games for sure, no TV. The reason for the video games issue is because the frame rate's so high, the refresh rate, is it puts a lot of stimulus into the eyes and it can overload the brain. And so we don't really want to do that. So, but you've got to test these things. You got to look at the eyes, see how they're functioning, make sure movement's fine, make sure tracking is good. The stimular stuff or balance, you've got to check that. So there's a lot of little things that you've got to look at to ensure that this athlete is 100%. Now, it's very important that they're 100% before they go back. 90-95% isn't enough. There's an issue called the second impact syndrome. Second impact syndrome can be lethal. And so this is why we have to make sure that they're 100% ready to go before we put them back in. That's one of the big things. That's one of the most important reasons why you go see somebody who's trained specifically in concussion therapy. Just because they're, you're a primary care doctor, or they're a good ER doctor, or they're the best neurosurgeon in the world, doesn't necessarily mean that they know when they've been trained and they've worked with concussions in the field. So getting somewhere where these people know what they're doing and are trained, that's the best thing to do.